What is Crohn's disease? Project by Klaus, Dillian, and Heist. Crohn's disease is in a group of conditions known as inflammatory bowel diseases or IBD. This disease is a chronic inflammatory disease of the gastrointestinal tract or GI tract. Crohn's disease can affect any part of the GI tract, from the mouth to the anus. Ulcerative colitis is limited to the colon, also called the large intestine.
Crohn's disease is one of the two chronic inflammatory diseases of the digestive tract. Although both affect the GI tract, the areas affected differ. These two illnesses share some of the same symptoms. Symptoms include but are not limited to tenderness, constipation, weight loss, fatigue, ulcers, and AMP. Rectal bleeding.
A colonoscopy confirms which disease a patient suffers from, and determines the treatment plan. Crohn's disease is characterized by various signs and symptoms. No single test can confirm a diagnosis of Crohn's with 100% accuracy. Tests, exams, and symptoms are all evaluated. First, a physical exam is given, along with evaluating symptoms. A stool and blood sample are usually required to be sent to the lab to be tested. A colonoscopy will follow lab results.
A colonoscopy allows for small tissue samples to be taken and sent for examination under the microscope to confirm the diagnosis of the disease.
The colonoscopy will also show where the ulcers are located, which helps in determining which form of IBD the patient suffers from. The location of the ulcers combined with other symptoms determines the severity of the disease. The severity is necessary to determine the best treatment plan.
Severity of symptoms can vary throughout a patient's life. Crohn's is a chronic disease with alternating flare-ups. Patients can even go through periods of remission.
Are there any risk factors?
The main risk factors for Crohn's are environmental factors, dysregulated immune system, and genetic disposition. Environmental factors include infections, medications, and AMP. Smoking.
The use of medications such as non-steroidal anti-inflammatory drugs trigger symptoms and increase certain risks.
And did you know that inflammation plays a major role in Crohn's disease? Inflammation can weaken epithelial lining, which leads to bacteria pouring in, and ulcers forming.
When the small intestine is inflamed, it makes it harder to digest food, and to absorb nutrients from food. Inflammation can cause a cobblestone pattern on the lumen wall.
The patient will also need to make a diet change. Some foods may trigger symptoms and should be avoided. Common trigger foods are foods such as alcohol, oils, fried foods, and dairy. The pharmacologic treatment depends on if the patient is experiencing active symptoms or to prevent relapse. The more potent drugs are saved for severe Crohn's cases.
The main goal for your doctors is to keep inflammation down and to tailor a treatment plan to you, your symptoms, and lifestyle. As she said, a diet change can make a huge impact.
Keep in mind a doctor's first goal is to control the disease. Once controlled, they will then plan a treatment to keep you in remission. They will be with you every step of the way.
Is Crohn's a lifelong disease?
Yes, Crohn's disease is a lifelong, but manageable disease. At times it can be embarrassing, difficult, and hard to come to terms with. Over time it does get easier and manageable.
Crohn's disease is a lifelong, yet manageable disease. It's a type of IBD causing prolonged inflammation in the linings of the GI tract. Some areas become swollen and ulcers form. Severity of symptoms depends on what part of the GI tract is affected. This disease may go through periods of alternating flare-ups, and hopefully remission.
Tips to keep in mind include keeping a food diary. Stress increases symptoms. Be prepared for public outings, develop a healthy routine, and create a good support system. Developing a good relationship with their doctor combined with self-awareness will help a patient to live a long and healthy life.